Hey guys, it's Alex from Dental Growth, and in this video I'm going to talk about how to increase case acceptance, especially from online marketing leads, right? So when we are running the ads and we're getting in touch with the inquiries that are coming in, and then eventually we do get the appointment, and then eventually we do get the showed appointment. Even if we get a good amount of showed appointments, but a lot of them apparently are quote-unquote low quality, or we're not able to get an actual start from them, it can very quickly become not fun. So we want to make sure that we can get a good start rate from these new patient appointments. And I'm going to go over some case acceptance principles here and some general ideas that can help you close more of those cases that come through. Now, this isn't going to be entirely specific to an exact workflow, but these are more ideas and concepts as far as getting patients to understand treatment and become emotionally invested in the outcome and know the problem that they have, so they have enough desire to actually get it fixed and make the payment and start. So with that being said, the first tip is to let them know what may happen if they don't get this done. So a lot of times, things that we know, the patient does not know. And a lot of times we forget to verbalize these things and educate our patients on the different issues that can come about if these things aren't addressed. For example, if they don't get the crown, the tooth has a risk of fracturing or decay continuing to need a root canal, or eventually the tooth may need to be pulled if this isn't addressed, right? These are real things that could happen if they don't get this done. Another tip would be to give kind of an easy, short explanation for most of the treatments that, you may be discussing. If we're talking about a filling, we need to get this filling because part of the tooth is missing and there is a cavity there that can continue to eat away at the tooth. So I used simple language that the patient can easily understand, and I also gave a quick explanation. We need this SRP because there's bacteria actively eating away at the bone around the tooth, and we need to get rid of that bacteria. We need to get this root canal because there's an infection down in your root, and we need to clean that out. With that being said, another tip would be to utilize imagery, whether that's physical models, the X-ray, online images on Google, etc. And I've also seen that you can potentially print out the X-ray or print out the clinical intraoral image and give it to the patient to take with them to really, just continue to look at, continue to be reminded of the problem and remember why they're getting this done. Another tip would be to simply evoke the right emotions. They say in communication, it's not as much what you say, but how you say it, right? So conviction, belief, confidence, right? These types of things where you're transmitting that this is a sure thing that you deeply believe. And they are going to take your authority and your expertise and also believe that thing, okay? And then also kind of transmitting your passion and your belief that this is something important, right? That they need to get done. This isn't something that's, it's not really a problem, you don't need to get it done. No, this is an issue, right? This is a problem that is important to get fixed, right? And you are obviously confident in your treatment plan, in your prescription, etc. Okay, so evoking those right emotions and just saying things with proper conviction, importance, passion, and tonality, and also making a connection with that patient, rapport, right? Empathy, being friendly. When they do come in for that first appointment, they feel welcomed. They feel like there's a sense of rapport. So evoking those right emotions and the right vibe, you could say. The fifth tip would be to not gloss over the problem per se. This is something that I made this mistake several times, and it's simply not communicating the importance of getting this problem fixed and the things that may occur if this isn't fixed, right? That is a big cavity. That's a big deal. It's not a little deal. We see so many of these things that maybe their importance kind of dwindles in our mind, but for each individual person, that is a big deal, and we should communicate that to them because otherwise they don't realize that they have an important problem that needs to be solved, and any amount of urgency to get it fixed is less than if they do feel that this is a pressing problem that needs to be fixed. Okay. Tip 6 is financing options. Obviously, if there's a large ticket treatment plan such as All-in-X, etc., having financing options is going to be crucial, if not used every single time. So having good financing options, so having a little bit of flexibility there can help, but it's very likely that you will be using financing for higher ticket treatment plans such as All-in-X, etc. Tip number 7 would be consider tackling the treatment plan piece by piece if they aren't able to kind of agree to the whole treatment plan, right? If it's overwhelming, right? Just kind of say, we're going to start here and go from there, right? A lot of times things are a bit overwhelming and big, but if we just, obviously we presented our whole treatment plan, but we're going to just start here. It's more bite-sized, it's more tackleable than planning out each and every treatment, right? It's a bigger yes. There's more friction to that ask as opposed to we're going to start with this and go from there, okay? So consider that as well. Tip number 8 is when you do, see that patient for the initial appointment, consider getting a deposit for when they are to return to start that treatment. I've heard a 10% down deposit, right, for that next treatment so that they are committed to starting on that next visit, right? At least financially, right? So that show rate is going to be higher for when they start that treatment, right? And you're just getting that acceptance and that commitment to actually starting treatment. So consider getting a deposit. Tip 9 is simply having easy to understand verbiage and language. The patients simply don't know our dental jargon, so we have to use words like bone infection as opposed to maybe abscess, although people probably know what an abscess is, but cavity as opposed to pulpal caries that have surpassed the tertiary dentin or whatever, right? Just use simple, easy to understand words, not too long and drawn out or confusing, and give simple, short explanations. And also, don't be afraid to describe the importance and the severity of this problem and what may occur if they don't get it fixed, right? Because then they may not feel inclined to get it done. Their health may continue to deteriorate. So it's important that we realize that this is a severe problem for them and communicate that to them accordingly. So that being said, guys, these were 9 case acceptance tips that you can hopefully implement in some of your new patient appointments to increase that conversion rate. So if you are a dentist that's running ads or getting new patients and you'd like to potentially implement a marketing system to get new patients consistently week after week, month after month, or if you're an agency also running ads for dental practices and looking for more help, feel free in either case to book a call with me in the link below and I'd be happy to chat. See you guys in the next one. Take care.